good evening to all comrades and friends and members of Parliament, and more especially to any Guyanese at home who may be following us. Mr. Speaker, I would like to join in congratulating the Honourable Minister of Finance, Dr. Ashley Kumar Singh, and at the same time I'd like to recognize that this is not a one-man job and he must have had a superb team. Let's celebrate that team of hard-working public servants who are, like our nurses, working under severe conditions. Psychologically, they're working during a very crisis period of the pandemic. So we want to congratulate him, and we like him to take those congratulations back to his ministry. And they've been doing this for many years now. Now, there are many things that distinguish this budget. First of all, it's an early budget, and I'd like to talk on that a little bit. It's an early budget, and we hope that in the near future, based on the use of his team, that we'll be able to get it even earlier. And why? This early budget does something. It allows the apparatus, the civil servants, the public servants in the regions, and so on, and in institutions and in the agencies, to have more months to execute the plan. And many of us, sometimes probably some sitting here who never thought on this, I can probably share this with you. Usually we might have the budget coming out as late as March, April. So we're giving our apparatchiks, we're giving our officials 9 months to execute a 12-month budget or 12-month spending. That was definitely unfair to them. Monies might be returned and so on. So I want to congratulate the team for the early budget, and it gives them an extended period to execute the job, and at the same time to take the message to the citizens in the area to get them incorporated and sympathetic with what we're doing. So I'd like to develop that. I would have liked to bring to your attention that concept of early budget, and do urge the minister to see if he can make it even earlier. Give us a Christmas gift the year before, so we can come to the new year already prepared. It's a mega budget, but what's very interesting, comrades, colleagues, it's a mega budget, but no one has mentioned this so far, as I guys have seen. There are no new taxes, so we have a big budget, massive budget, mega budget. I like that term. I'm stealing it from a press article, media article. But no new taxes. Congratulations. And this is the way the PPPC is taking it. We're going to mobilize monies by cutting other edges and so on, but not imposing taxes. Modernization budget. Indeed, this is a transformational budget. The PPPC is now trying to take up where it left off after the cabal was able to sneak themselves in. You know, after that little period, they really set things back. Fortunately for us, they're so incompetent that the destruction they did to some of our programs did not spread to others. They were just too lazy to go around destroying everything. But we're back in the saddle, as it were, and it's a modernization budget. Modernization budget. In other words, as some persons, especially the younger folk I was having a little discussion with recently, they say, you know, we can call this budget Getting Guyana Back on Track. One Guyana. And that term seems to get under the skin, right? Getting it right, getting one Guyana. Now I invite all Guyanese to join in looking at building back better, bigger, brighter, bolder. That is what this budget is doing. And it is doing that in severe conditions, against in the background of pandemic, against background of the flood that we had not too long ago, and such other things. So I want to invite all Guyanese to join in this exciting task. This in itself could foster unity, working purposefully for a costed plan, because a budget by definition is a costed plan. So I would like to invite all of us to come together, and it's good to have the rhetoric here, the little bubbling up and so on, especially from the side across there. But I want to get to the supporters, and they do have supporters, we must recognize that. And we want to get over to them to say, let's build back better, bigger, brighter, bolder. And this reminds me of the 92-93 period when we took power after long bleak years. There was excitement. I think people were hoping to build things back, and we did build back. We have that opportunity here again. Building back better, bigger, brighter, bolder. I want to invite all Guyanese to join in this exciting task. This in itself, I repeat, could foster unity and one Guyana. The budget itself is replete with many measures that are positive. I'd like to list just a few and bring them to your attention. Measures to strengthen government agencies. It's there, it's financed and right across at the national and at the local or regional levels. Measures to improve government efficiency. Measures to incentivize the private sector to join the government in buffering the disastrous impact of the current COVID public health threat, because it's a public health threat. It's right. That's how it's defined even by the WHO. It also includes measures aimed at helping the most vulnerable of our citizenry, workers, single moms, and that's a very important category, single moms. They will be determining the future generation, how they are able to bring up or not bring up their kids. And then, of course, you might say, let's call on the men to be more responsible. Single moms, old age pensioners, dismissed sugar workers, people living with disabilities, indigenous communities, bashed or battered by the recent repeated severe protracted floodings. And many of us who don't know or don't travel to the hinterland might not know it, but in recent months, or the mid part and later last year, there were massive floods in, for example, Region 9, flooded the cassava fields totally, not for a few days, but forever. So they could not even salvage some of the crop. It was just rotten. So we need to look at our hinterland citizens and see how we can take them into consideration, although they're far out. And of course, these things were precipitated forward by protracted flooding, and flooding occurred not only in those distant areas, those remote areas, but right here on the coast. Measures aimed at countering the impact of climate change, recognizing that Guyana is a small, low-lying coastal state. And here again, I must remember or bring to your attention something that we now take for granted. The Hope Canal. Probably many youngsters who didn't know about the construction of the canal, passing it might think it's some extension of the Atlantic Ocean. It's so big, it's so effective. But what's more important, the Hope Canal now will be having partners, because it has proven its effectiveness. And remember how they laughed at it? Remember how they ridiculed it? And now it's taken for granted, and the great job that it's doing in that area. To such an extent that the Hope Canal multiplied by 2, as I put it in my notes, the Hope Canal now will be having two further partners, or two further offspring, should I say, because as we understand from the budget, they're going to be using that example, that experience to put similar ones in other areas to stop the flooding, because rain will not disappear from Guyana. We have to learn to live with it. We have to learn to live with floodings. We have to mitigate. We have to plan ahead. And this is what makes me excited with this budget. It does exactly that based on the experience with the first Hope Canal. Measures aimed at creating, training, and retaining the brain power to manage and maintain the new Guyana in these adverse conditions. Note the continued support for the massive 20,000 scholarships program and the upgrade. This is a point that, because I lived in the quarantine, I lived in Barbados for almost a decade, and the upgrade of the Gaisuco reputable Port Moran training school to a technical training college with a more robust curriculum. That might look like a small thing, but if you know the repetition and the recognition that institution enjoys right across, even in communities overseas, Guyanese communities, you recognize what a progressive step that is. A training school, the training school at Port Moran will be upgraded to a technical training college with, as I understand it, a more robust curriculum. Further, measures are included to address the needs of other small but valued Guyanese struck by catastrophic diseases, the treatment of which could financially ruin them and their families. For example, budgetary support for dialysis. I noticed that several persons did refer to it, but that is it's a life-saving activity, but it's expensive, and we need to look at it. We have a small public health sector capacity, and we need to work on that. But those measures are included to continue addressing those issues, so that no catastrophic disease can financially ruin a patient or a Guyanese citizen and his or her family. Measures to restore the money transfers from the state to children and their families, which were introduced by the PPPC government and which were withdrawn by the APNU, PNC, AFC, Granger, Nagamoto, Ramjit, and Cabal as soon as the coalition assumed office. As soon as, and I think my good friend Prak is depressed now. I've been looking at him, and I think I don't know, I got to go to Seaside or Riverside or something and do some little walk there, you know. So we're going to talk on that. Measures to restore the money transfer, listen well, Prak, from the state to children and their families, which were introduced by the PPPC government and which were withdrawn by the APNU, PNC, AFC, Granger, Nagamutu, Ramjit, and Kabal. As soon as they came, as soon as the code.
Honorable Member, the Honorable Member, Mr. Ramjitan, please.
What's more, some youngsters asked me to remind you that even while they were doing that, they were increasing almost immediately their salaries by 100% in some cases, surreptitiously, never told, you know, and they used to be telling us the PPPC ministers are fat cats. So they didn't reduce it, they added to it. Right. So, now this budget, Mr. Chairman, Mr. Speaker rather, this bold budget, this transformational budget comes against a especially bleak global background. Let's look at what I mean by that. One, the COVID-19 public health threat declared by the WHO, World Health Organization, to be of international concern resulted in an international lockdown and the consequential difficulty in accessing imported inputs and in the steep rise in their cost, that is the cost of imported inputs. Humanity had not witnessed such a pandemic since the dreaded Spanish flu in 1918. And finally, protracted severe repeated flooding in coastal and hinterland communities in Guyana. Those are the two big, that was against that background, we had to now mobilize our resources to fight the dreaded pandemic. And we did well, especially the Ministry of Health, Dr. Frank Anthony led the team well and continues to lead the team well. And we must not forget them. The frontline workers, the nurses, the ladies and gentlemen trained to be nurses, but doing so many other things. Under the tents, starting on the Square of the Revolution, now in the compound in the Ministry of Health and so many other venues. So I want to put a plug here for encouraging the vaccine resistant or the vaccine reluctant to get vaccinated as soon as possible, fully vaccinated. And at the same time, I want to recognize the good work being done by the nurses and other frontline workers. So the COVID public health threat declared by the WHO as of international concern was against, those are one of the things against which background we developed in this budget. And the protracted repeated flooding and constant flooding in certain areas in Guyana. Now, we also notice the training in the budget. There's adequate. Well, it could never be adequate. You always want more training, but there's good provision for training of our workers. Training of in the nursing school, for example, that's got mentioned where it's going to be properly equipped and properly staffed and so on. So this is the next very good thing that I've observed, and I'd like to bring it to your attention. The amount of the resources to train nurses and other second-level professionals, that is not the doctors and the specialist level, seems interesting. It has not been decreased. It could always be more, but I'd like to congratulate the Minister of Health or Minister of Finance for having found those monies. And the investment in that section of our workforce is being seen, the correctness of it is being seen now with the response to the pandemic and the vaccination for the virus. And what I'd like to point out too, a little plug again for Angels in White. Guyana is suddenly interested in vaccinations and in the COVID and lining up to get it and so on, and there's a big discussion. But our nurses and our system might have responded so superbly because we have a great history, one of the best in the world, one of the best records in the world of vaccination programs. And I'm not speaking of the Johnny-come-lately virus, the vaccine for COVID. Over the past years, and especially starting under the PPP after 92, 93, around there, we have been able to effectively and consistently over the years vaccinate up to 94 to 98% of all our population of toddlers and babes in arms who need the injection, need the vaccine against the vaccination against vaccine preventable childhood diseases. And I think there are about 20 of them. You remember the HPV vaccine when we introduced it, there was great resistance and so on. Or not great resistance, some resistance with some uninformed miscreants picketing the Ministry of Health and so on. So we have a glorious history, and when I look back and see how much work we did, it's unfortunate that we have to now mention this, or this only comes up for public viewing and public interest when because of a pandemic and we're discussing the pandemic. And then again, we like to note in this experience of the good work the nurses and the system does at the health center level, at the level of the community health center. I'd like to make a plug here for men's health.
Before you make the plug, you will have to get more time.
Yes, thank you, Mr. Speaker. I'd like to ask that the honourable member be given 5 more minutes to conclude his presentation.
Thank you, Minister Teixeira. Honourable member, you may continue.
Thank you. Well, I close by saying that men's health. Usually, we now focus on health, we focus on lining up, and it's very interesting to see some very big, strong men, some of them looking that if you know you don't want to talk to them, they might bite you. They're lining up meekly like little children to get the job. That's good. Let's build on that. Let's, out of crisis, make opportunity. I see Mr. Ramsarran, the Honorable, is shaking his head. We can probably have a little chat on that in the corridor sometime. Men do not have a proper health-seeking behavior. They drop the wives off with the kids at the health center because they're going to the baby clinic, okay, for either second pregnancy or a third pregnancy, while at the same time taking along the toddlers to have their vaccinations, for the routine vaccines, as we call them. I want to bring it to the attention of the House and to the members that we need to get the men more involved. Let's use this opportunity that they're interested. They come and line up on the square of revolution, men, you know, and let's now have them not only drop off their wives or their partners to the health centers for the maternity clinics or for the child clinics, but get involved themselves. Let's put men's health on the front burner. Coming out of this crisis, it's a bad experience, yes, but let's get as much good out of it. So, Mr. Chairman, with that, I'd like to thank you for the extra time. And men's health now is on the agenda. Please, let's use coming out of the crisis. Get vaccinated. Get the jab, get comprehensively, get totally vaccinated, full coverage, and at the same time encourage the vaccine reluctant, but at the same time special invitation to the men to join your wives, join your spouses, join your child mothers to when they go to the health center, so that you too you would remember this time when I started to go to the health center, and you'd remember a good thing coming out of this terrible experience we have with the shutdown and generally with the COVID invasion of our spaces. Thank you, Mr. Speaker.
Thank you, honourable members. Honourable members, this concludes our business.